Hi everyone, welcome back. Today we're joined by Dr. Andrew Frost, a physical therapist at our Tosh Center here in Utah, about how to keep your body in shape during this time, especially when you're working from home. Andrew, thank you so much for joining us.
Glad to be here. Thank you.
So, what are some signs that your body might be stressed, and what are some things that people should be looking out for specifically?
Yeah, so a few things to look out for. One would be kind of general muscle tightness, especially kind of in your upper traps or kind of this shoulder muscle right there and into your neck, maybe your jaw. So paying attention to kind of how much tightness you feel in those muscles. You might also be getting some headaches, some tiredness in your eyes and things like that you want to watch for.
And what are some quick things that people can do to relieve stress while they're working at home?
Okay, yeah. So a few things that you can do. First, you want to keep moving, right? You don't want to be staying in one position for long periods of time, right? So if you're generally tend to sit for work, you might consider getting up out of your chair every hour, walk around, do something. If you have the ability to kind of change from a seated position to a standing position, like go from a desk or a table to standing at your kitchen counter, something like that, that would be a good way to change positions. Doing that every 1 to 2 hours would be helpful. You can also do a few quick little exercises to help loosen things up as well as keep you moving. One of those would be probably some backwards shoulder circles. So you just sit up nice and tall, relax your shoulders, and then just do a backwards circle with those shoulder blades, nice and slow, nice and controlled. Focus mostly on the squeeze back and the pull down portion of that motion. Don't feel like you have to like really scrunch your shoulders up as you do it, right? But just a comfortable circle. Do that 15 times or so every hour, every 2 hours, something like that, just to keep things loose. A couple of quick neck stretches that you can do. One would be, again, kind of you can sit on your hand, or you can put one hand behind your back, or even grab onto the chair that you're sitting on. One of those options, just to anchor that shoulder blade down, and then you're going to lean your body gently away, and then lean your head gently away till you get a comfortable stretch down the side of your neck and in towards your shoulder. You don't feel like you have to crank on it so hard that it's painful or anything like that. It's not that. Those muscles will respond better if it's just a moderate, comfortable stretch. And you want to hold that stretch for 20 to 30 seconds. And do that maybe 3 times, back and forth on each side. Another kind of variation on that theme would be grabbing on, bringing your chin down towards your chest, and then tilting away from there, letting that stretch for a good 20 to 30 seconds. Another exercise you can do is something we call neck retraction or cervical retraction, where you're just sitting up nice and tall and gently pulling your head straight back till you get a little bit of a double chin, right? And that's just going to stretch some of those muscles at the base of your skull that get really tight.
Let's talk about our actual setup of our space at home. I am in the kitchen of my house right now. I am probably not the best setup. I have like a kitchen chair and 2 pillows set up on the chairs itself. So what should we be looking at when we're picking out a space to work from home if we don't have a designated desk or area that we normally work? Should stuff be higher or lower than how your hands are sitting? Can you give us some advice for that?
Yeah, for sure. So when you're seated, your knees should be about at the same level as your hips. They shouldn't. The knees shouldn't be higher than your hips or lower than your hips per se. They should be pretty level. Your pelvis. So in terms of posture, the minute your pelvis kind of tips back like this, you're pretty toast. It's hard to have good posture when your pelvis is rolling back like that. So usually like soft chairs and couches kind of promote you rolling your pelvis back like that. So having a firmer place to sit, not necessarily so firm that it's uncomfortable, right? But not so squishy that you're sinking into it and it's hard to pull yourself out of it, right? So that's good. You want your elbows at your sides at 90 degrees to be able to hit the keyboard like that. Mouse should also be at that same level. You shouldn't be reaching for that mouse too far. It should be pretty close to you. A lot of folks really like putting a pillow underneath their arms to kind of support the weight of their arms a little bit while they're typing on the keyboard. That's a good suggestion. Once you're in that position, you want to be thinking about where your sternum is. If your sternum is kind of collapsing in, that's not the best, right? You want to be able to lift your sternum up just a little bit and then stack your head up on top of the rest of your spine. Chin shouldn't be forward or anything. Your ears should kind of line up over the top of your shoulders, and then the shoulders over the top of your hips. Those are kind of the best tips that I can give you for seated working. Standing is going to be similar if you can set it up like that, in the sense that your arms are at your sides, elbows at 90 degrees, keyboard here if possible, and mouse like that. If you don't have a monitor and you're working from a laptop, you're going to be looking down to see the screen a little bit, and it's much better to look down with kind of a chin tuck sort of thing, a double chin sort of motion, than it is a bring your whole head forward sort of look. So if you can be aware as much as you can to keep your head in this sort of position, looking down at the screen, rather than that.
Does the lighting of the room make a difference on how your body reacts to stress and your work environment? Should you be working in like a dimmer lit location, or is there certain light bulbs that are better for your body during work from home?
Yeah, so certainly there's a lot of blue light going on from your screen, right? So if you are using lights outside of your computer that are kind of more blue, that'll just be a lot of blue light coming at you. So try to avoid that a little bit. You don't necessarily want to be in dim situations, because then you're going to be kind of squinting a little bit more, and sometimes even if your screen is really bright but the room is dark, that contrast can bug your eyes a little bit, and so you want to just be kind of middle of the road in all those things.
What about using your phone as well when you're working? I've seen some things where people say that you should not ever really be like looking down at your phone, but more so having it like directly in front of you, which is good for not only right now when a lot of people are working from home, but just in general, because we're always all on our phones. Do you have any tips for that type of device?
Yeah, for sure. So same kind of concept in terms of you do want to have the phone up as best you can, but it's hard to hold your arms up like that for long periods of time, right? So when it's down, you want to try to use your chin, that kind of double chin sort of motion, to get most of that look down as you're texting, right? And at the same time, you don't want to round your shoulders forward. You don't want to do this sort of thing. You don't want to be curling up into a ball like this, doing that kind of thing, right? As much as you're able to be aware of that, it's really hard to be thinking about all these things all the time and focus on what your work task is doing. Mm-hmm. So you just have to kind of schedule in pauses where you just check into your posture and make sure things are going okay, and zero back in on keeping some of these good principles, and then get back to work, right? Do what you're doing.
So besides from just working at home, people might be experiencing a harder time sleeping right now too, just due to the stress and anxiety they might be feeling. Do you have any tips on best positions to sleep in, or what you can do in the morning when you wake up, just to help your body kind of get the rest that it actually needs? Yeah,
so a few things about that. In terms of position, that's very variable from person to person. If you're a side sleeper, you certainly want your pillow to be tall enough to keep your head kind of in neutral. You don't want it to be so short that you're sleeping all night like that. You don't want it to be so tall that it's pushing you the other way. Just nice and neutral. Also, if you're sleeping on your side, usually you're kind of in this little fetal sort of position, right? And if you're sleeping like that, you want to make sure that your head's not sticking way far forward, right? You want it to come back more like that as best you can. It's hard to control these things when you're sleeping, right? Back sleepers, a lot of folks tend to like a little pillow underneath their legs. That can help with low back pain sometimes. Certainly, I would encourage folks to, especially if you're feeling stressed and having a hard time falling asleep, setting up maybe 5 to 10 minutes before you go to sleep to do some diaphragmatic breathing, some belly breathing, right, where you're lying just on your back nice and comfortably. You've got maybe one hand on your chest and one hand on your stomach, and you're trying to to breathe in a way that you only feel that belly hand moving up and down, right? So as you breathe in, that you should feel like that air kind of passes through your rib cage and just fills up your belly like a balloon. And you breathe out, and it should decrease, and then it should inflate again and decrease down at your belly. And you should feel very little motion up at your ribs. And if you focus on breathing like that, and then maybe go from joint to joint and kind of just relax your whole body, feel like letting gravity take over is kind of how I describe it to patients, where just let things sink into your mattress and try to relax a little bit. Sometimes people have a hard time letting their mind calm down. So if you find something like a sound that you can focus on to, sometimes white noise machines help a lot. There's apps that you can download for free that give you some white noise, something that you can focus your attention on the sound rather than letting your mind spin through the thoughts that are worrying you.
Yeah, I listen to music every night while going to sleep. I have a
Yeah.
sleep playlist.
Nice. There you
My Spotify thinks that all I do is listen to sleep music. But I found that really helpful
Awesome.
to have some sort of white noise in order to kind of let my mind forget about work for a minute
Yeah.
and actually go back to getting the rest that I need.
Yeah.
So if you have a patient or if you are someone who was getting physical therapy before, what are some instances that people should still go see you guys for care?
Yeah, so currently the guidance that they're giving us in terms of screening patients for who can come and who cannot come are generally patients that are in the older population that have some significant comorbidities or other things going on that may complicate their case if they were to be exposed to the virus. We try to really limit those folks. Sometimes we'll put those patients off a little bit if we don't feel like it's super urgent that they're getting therapy. If it is pretty urgent, then we'll have them come in and we'll give them an evaluation, and then we'll try as best we can to switch to kind of video follow-ups. For other patients, so surgical patients that they can't afford to not move around, or their joint will freeze up or things like that. We're still seeing those folks. Also, people who are in so much pain that they're not able to really function and do the stuff that they've got to do at home. We'll see those folks. Again, we try to limit how much we see them, but we'll see those folks. Anybody that's in so much pain they might end up at the ER, we'll see those folks still. That's kind of the general overview.
So if you happen to get an injury right now during this time that's brand new, it sounds like you'd still have to go get an evaluation in person from you guys. If you were to tear your ACL or sprain your ankle or do something like that, are you still able to give them care over video and kind of give them the tools that they need so that they're not hurting themselves in the long run?
Yeah. So they're still working on ironing out some of the logistics of doing evaluations over telehealth, but certainly follow-up visits right now where we can do via telehealth, and we can make sure that they're taking care of themselves and doing okay. I'd imagine that the telehealth visits will probably be online pretty soon in terms of evaluations, because everything else is online. We just got to iron out some of the things for how we're looking at that kind of logistically and legally and all that kind of stuff.
Yeah, and I'm sure as a PT, you guys kind of know if someone describes to you what's happening, you can kind of figure out without actually seeing a person potentially what's going on as well.
Yeah, for sure. And and something we've always done over at Tosh is we've done what we call free assessments, where we'll have somebody that comes in with a simple injury or knee pain or back pain that just wants a little bit of some guidance on what they should do, and we're able to give them just a little bit without formal treatment, and give them some suggestions on when they should seek further care and things like that.
My sister has actually taken advantage of that.
Nice.
We're big skiers, so we always try to get the best pre-care possible for stuff like that. Is there anything else you kind of wanted to mention today about stress in your body and what you can do to prevent further implications?
Yeah, so you want to do a couple things. Both. So a lot of times when we're stressed, we're also kind of clenching our jaw and things like that, and plenty of folks will get kind of jaw-related pain and headaches associated with that. So one thing that you can do is just put your jaw in what we call the resting position, or the end position, where you kind of take your tongue, rest it on the roof of your mouth, almost like you were going to say the letter N. It's also the same position if you were going to like click your tongue. So that kind of position where you've created a little bit of suction between your tongue and the roof of your mouth, and there's a little bit of space between your teeth, and you just kind of try to maintain that position and let your jaw relax while you're working. So you try to maintain just a little bit of space between your teeth, tongue on the roof of your mouth. Don't clench and bite down and give yourself some headaches that way.
That's good advice. Well, Andrew, thank you so much for joining us. We really appreciate it. And if you guys have questions about COVID-19 related to symptoms that you might be experiencing, you can call our COVID-19 hotline at 844-442-5224. We also have an emotional relief health hotline that you can call, and that phone number is 833-442-2211. That platform is available 7 days a week from 10 a.m. to 10 p.m. and is completely free for you to use. Thank you so much again for joining us, and we will talk to you guys next time.
Thank you.
Thanks.